Okay. Well, good afternoon, everyone, and welcome to this online discussion on the historical perspective on disease and the role of environmental and public health called Epidemic. And my name is Dr. Aaron Lawson, and I'm a lecturer in environmental health at Ulster University based in Northern Ireland. And this event is part of the ESRC Festival of Social Science 2024 series. So what is this event about? Well, not all heroes wear capes. Some work in environmental health. And we've all lived through a pandemic, but how could you help tackle a future public health crisis? So this online presentation and Q&A session really examines past epidemics across the UK and beyond, and also how environmental health and public health have developed over the years and the careers protecting public health. Now, to start things off, I'm going to ask you a very simple question, and this is really to gauge your understanding as members of the public or from whatever background you're coming from as to what is environmental health? What does it mean to you? So in a few words, can you describe what environmental health is, i.e. what do they do? Now you can join the Microsoft Forms link using a mobile device. So you can open up your camera app and scan that QR code on the left-hand side, or there will be a link posted to the question in the chat for this presentation on Microsoft Teams. And I'll give you a few minutes to consider that. So in a few words, can you describe what is environmental health? What does environmental health do? And there should be a web link in the Microsoft Teams chat to that question. And I'll just double check that. Yep, it appears there. And what we can also do then, we can start looking at some of the responses. So I'm going to reshare my screen. We can see it's already generating a nice little word cloud. So in a few words, can you describe what is environmental health? What does environmental health do? I'll leave it for another 30 seconds or so, just to allow anybody else that has joined to answer the question. And you can find the link in the Microsoft Teams chat. Okay, so another response has just come in. Well, we can start exploring this. We can see there are a range of different answers coming in, but in essence, you're all saying the same thing. Now, the word that is highlighted the most, public health in the center there, followed by safety, environmental factors, protects the public, and there's a lot of words there around health protection, public protection, ill health. Really, environmental health, we work across the three main spheres of public health, and that's something that I will talk about later on. In terms of what environmental health is, some of you have latest responses: protecting the public, ensures public protection, the safety of everything in the environment. We do everything pretty much that no one else does. That's very true. However, in the main, food and safety, environmental protection, and private housing. Yeah. So it's nice to see that range of different answers, and it's nice to see that, um, as members of the public from across the UK, that you all have a general good idea of what environmental health is about, and that's good to see. So if we return to the presentation, and then we can explore some of these answers and issues really that you've raised. Apologies, everyone, my computer has decided to go act very slowly now. Okay. So what is environmental health? Well, environmental health encompasses all of the external factors that affect human health and well-being. And as some of you may know, environmental health practitioners, i.e. the people who work in environmental health, can be found in every community, and they work really hard every day to keep us all healthy and safe and to reduce what are known as health inequalities. And we know that depending on their role, an environmental health practitioner can be a generalist, working across all of the different core areas of environmental health, or they can be specialists with particular areas of expertise. And we know that there are environmental health practitioners that work at a global level, at a national level, and very much at a local level, both in the public and private sector. And in terms of the core areas, for those of you who may not be aware of what environmental health does, well, they work across these 5 core disciplines. You have environmental protection, food safety and integrity, health and safety, housing and communities, and also then public health. And environmental health, as defined by the World Health Organization, is a wing of public health. We work to protect people's health and well-being across their life course. Now, in terms of today, the current profession looks very much different to its earliest roots. And the story of environmental health as the profession we know today has its roots primarily in Victorian times, but we also need to look back further, back to times when disease, ill health, and mortality were rife. So during the Middle Ages, and the Middle Ages refers to the time period of roughly between the 5th and the 15th centuries in Western Europe after the fall of the Western Roman Empire. And during the Middle Ages, infectious diseases were commonplace and often in epidemic proportions. And this has been very well documented through artwork and through different literature and written records and so on. And there were various different epidemics at the time, some of which included leprosy, smallpox, tuberculosis, scabies, sweating sickness, otherwise known as influenza, as well as various sexually transmitted diseases, dancing mania, and many others. And just another quick question then on that, to really gauge your understanding of what is the definition or what is an epidemic. So there are a list of answer options, and again, you can join using the same method, either using the QR code or there will be a link posted in the chat, the second link. So what is an epidemic? And you can choose one of the following 4 options. An epidemic is an increase in the frequency of occurrence of a disease in a population above its baseline level. An epidemic is the worldwide spread of a new disease. Epidemic is the name of a cool death metal band. Or an epidemic is the spread of a disease only amongst sick people. And again, this is to sort of gauge your understanding as members of the public as to what epidemic is, because we hear these terms. We all lived through the COVID-19 pandemic, but what makes an epidemic different to a pandemic? Because we hear all of these different terms. So I'll give you a few minutes to think about that and to choose one of the answer options. Let's have a look. So what is an epidemic? Thinking about some of the responses. Oh, we have 17 responses so far. And correctly, all of you have chosen the right response, which was the first one. Okay. An epidemic is an increase in the frequency of occurrence of a disease in a population above its baseline level for a specified period of time. So it's good to have an understanding of that as I go into in the next few minutes into talking about major other epidemics that occurred in Europe and the UK during that time of the Middle Ages and so on. Okay, so if we go back to the presentation. I will say for that question, there is actually a death metal band called Epidemic, so if you had chosen that, it's not always wrong. Okay, so thinking about public health in the Middle Ages and the reason for all of these various different epidemics occurring, well, medieval towns were very much unhealthy places, and public health certainly was not high on the agenda of most town councils, and there's multiple reasons for that, which I will talk about later on. Now, many towns, for example, did not have sewage systems in place or supplies of fresh water, and probably smelled quite awful as well due to all of the food and animal and human waste, which was typically just thrown into the streets. Houses in medieval towns and villages and cities were made of wattle and daub. And the way they were built, a lot of the alleyways are very narrow, they cut out light and air. Rodents and lice and fleas and things like that, they flourished in these unsanitary conditions in these medieval towns and entered homes and businesses and so on at ease. And so it's hardly surprising then that disease thrived in such medieval towns and cities. And for many of the peasants living at the time, disease and poor health were simply part of their daily life, because as well as that, medicines were often quite basic and not effective at treating disease. And the poor living conditions and poor diet led to many health problems suffered by both the wealthy and the poor. So anemia, for instance, was commonplace, and that's a condition in which the number of red blood cells within the blood is lower than normal. And that's a disease that particularly affected young children, adolescent girls, and also pregnant and postpartum women. Other disease conditions that were quite common at the time included rheumatism, arthritis, infectious diseases like tuberculosis, and dysentery. Childbearing and possible childbed fever was also quite prevalent, and as a result, many women died during childbirth. And again, a lot of this was the result of the poor conditions that people were living in, the lack of access to safe, nutritious food, and so on. Influenza was also a common health problem. There were influenza epidemics, and it was commonly referred to as sweating sickness at this time. And like I mentioned earlier, there were various different sexually transmitted disease epidemics such as syphilis and gonorrhea, which were also prevalent at the time. Now, although all of these other disease conditions were serious and they were in epidemic proportion. They were pale, really, in comparison to the epidemic which impacted all of medieval Europe in the 14th century, otherwise known as, and I'm sure you've heard of it, the Black Death, sometimes referred to also as the bubonic plague. And this was a devastating epidemic that struck Europe in October 1347 and lasted until 1352 on the continent, when 12 ships from the Black Sea docked at the Sicilian port of Messina, and people gathered in the docks were met with a horrifying surprise, and that was that most of the sailors aboard the ships that had docked were dead, and those that were alive were gravely ill and covered in black boils that oozed blood and pus. And resultingly, Sicilian authorities hastily ordered that fleet of ships, or fleet of death ships as they became known as, out of the harbour, but it was too late. And on the map on screen, you can see the spread of the Black Death across Europe at that time, starting off in 1347, and you can see it moved more northwest as time went on, eventually reaching London in 1349. Now, over the next 5 years, the Black Death would kill more than 20 million people across Europe, which was almost 1/3 of the continent's population at that time. And 1 to 7 days after contracting the bubonic plague, people developed flu-like symptoms, so fever, headaches, vomiting, and they also had swollen and painful lymph nodes, which occurred in the area closest to where the infection entered the body. And we have to remember at this time, I mean, people really had no understanding of epidemiology or the transmission of infectious diseases and how different pathogenic microorganisms, bacteria and viruses and so on, infected the body, which obviously led to why it was so severe in terms of its spread. Now, once it reached England, it killed 1/3 of England's population between 1348 and 1350. In 1349, King Edward III actually complained to the Lord Mayor of London that the streets of the city were filthy, and he said, "The human feces and other filth lying in the streets and lanes in the city are to be removed with all speed to places far distant, so that no greater cause of mortality may arise from such smells." Now, the Black Death lasted in England between 1348 and 1350, but it did return in the 1360s, 1370s, 1390, and into subsequent centuries as well. Although the death rates in those later epidemics may have been lower than the Black Death, which was that period of 1348 to 1350 in England. Now, in terms of trying to understand, well, what caused the Black Death or bubonic plague at this time? Physicians and clergy at the time, they had their own ideas. So there was miasma theory, which is really foul air theory, where people believed that diseases were caused by foul or bad air that people breathed in, and then that made them sick. Also, they believed that dead bodies and rotting carcasses and stuff would give off miasmas, which would subsequently cause disease. Clergymen often blamed it on people's sinful ways and bad luck as well. They believed that it was God's punishment for people's individual behavior. And I mean, this is why at this time things like pilgrimages were very, very popular, because that was communicated to the public as being one of the ways to help prevent the disease spreading and from them to contract it, and also through prayer and other superstitions. Another theory that was put forward was an imbalance in the body's four humours, and that's based upon a Greek concept. Oh, sorry, I'm hearing some feedback. So that was based upon a Greek concept of individual health, And the four humours were black bile, yellow bile, blood, and phlegm. So the Greeks believed that the body was made up of these four humours, and that if there was an imbalance in any of the four humours, then illness would follow. And so physicians at the time who believed in the four humours theory, that it could be fixed via bleeding, via sweating, via making people vomit to help restore that balance. Now, there were other reasons, like I mentioned earlier. Medieval towns and cities and villages were very dirty places. Um, Public latrines were simply just emptied into rivers, which then became a breeding ground for disease. And people used water from these water sources for cooking, for drinking, for cleaning. The volume of rubbish that was produced, waste, meant that it was almost impossible to keep the streets clean. And that also then invited a number of different pests, which obviously lived in close proximity with people in those urban and rural environments. And even in towns which had some features which are aligned with public health, like bathhouses, for instance, and that was something that the Romans introduced, people didn't actually bath that often. So one medical book at the time advised people that spring and winter were good times for bathing, but that bathing should be avoided in the summer. I don't think that would be the advice nowadays for public and environmental health, for people not to maintain good personal hygiene. And also, quite simply, improving public health was not seen as a government priority at the time. Another reason that was put forward, and this was mainly by uh, astronomers or physicians slash astronomers who believed in this, but they also blamed the planets going out of line as being the cause of the bubonic plague. So, according to French doctor Guy de Chauliac, he said that three great planets, Saturn, Jupiter, and Mars, are all in close position. This took place in 1345. Such a coming together of the planets is always a sign of wonderful, terrible, or violent things to come. So, people at the time very much had different beliefs as to what caused sickness and ill health, including the plague. And like I said earlier, the plague was not only exclusive in Europe and in England and in the UK in the 14th century. There were future plague epidemics in the 15th and 16th century and also into the 17th century. So the next major epidemic that I will talk about is the Great Plague of London between 1665 and 1666. And it was the most recent major epidemic of bubonic plague to occur in England. Now, at this time, it did kill 20% of the UK's population and an estimated 100,000 Londoners. And Daniel Defoe, who is a famous author, he wrote Swiss Family Robinson, but he also wrote this book called Journal of the Plague Year. And if you haven't read it, I would encourage you all to find a copy. There's actually a free copy available online if you type it into Google. But in Journal of the Plague Year, which was published in 1722, it's a historical and fictional reconstruction by Defoe of the Great Plague in London at the time. And it was written as a second-hand account from a witness, an inhabitant of London that he had spoken to, who talks about the devastation that followed during the outbreak of bubonic plague at the time. And in the journal he writes, in June, the infection spread in a dreadful manner, and the bills rose high. The articles of the fever, spotted fever, and teeth began to swell, for all that could conceal their distempers did it, to prevent their neighbours shunning and refusing to converse with them, and also to prevent authority shutting up their houses, which, though it was not yet practised, yet was threatened, and people were extremely terrified at the thoughts of it. And I think there's actually a lot of parallels we can draw from the Great Plague epidemic in 1665 to 1666 and also the COVID-19 pandemic that we experienced in the UK and equally, obviously, across the world. Because even 400 years ago, people were scared of the disease. There were a lot of rumors and false information. Neighbors were shunning people who they thought who got infected. People were being threatened to be shut up in their houses and stuff. And the government at the time took various action to try and control the spread of disease. But whenever you read the journal, I think you can see those clear parallels, which is really interesting. So 400 years ago, people still felt the same way as they did recently during the COVID-19 pandemic. And this map is really just to show or to highlight the areas most impacted by the Great Plague in London at the time. So it was mainly the City of London, and the areas shaded in yellow and in orange were the ones that were hardest hit by the plague. So there were between 2 to 3,000 deaths per square unit in this part of London. And many of the people who lived there subsequently tried to flee to the countryside and so on. And a lot of this is described in Defoe's journal, and it does make for really interesting reading. So I haven't talked specifically about the cause of the spread of the bubonic plague at this time. And I'd like to pose that question to all of you now. So how was the Black Death or bubonic plague spread? And again, for those of you that have maybe joined a little late, you can find the link in the Microsoft Teams chat, or you can use your mobile device to join using the QR code. So was it an imbalance in the four humours? Was it due to miasmas? Was it due to rats, sinful ways and superstitions, the government, or are you not sure? And then we can have a look at some of the answers in about a minute. So how was the Black Death spread? And there's many other books written around this time period. Samuel Pepys, he famously, wrote a series of accounts which have been put into his diaries, Samuel Pepys's diaries, and you can find Journal of the Plague Year, Samuel Pepys's diaries in all major book retailers across the UK, but they really document what life was like at that time when, various different plague epidemics reached the UK, England, and London, and subsequently how people felt and what the government tried to do to prevent its spread. So maybe we can have a look at some of the answers. How was the Black Death spread, in your opinion? Okay, so some different answers. Most people have selected rats. One person not sure. Imbalance in the four humours. So black bile, yellow bile, blood, and phlegm, coming from the Greek theory on health. Nobody selected the government, sinful ways, or miasma theory. I'll leave that for another 30 seconds or so. Okay, so most of you have selected rats. Two people are unsure and one person selected the humours. Oh, there's some changes here. Okay, so we can go with the vast majority of people have chosen rats. And let's go back to the presentation and then we'll talk about this. So, how was the Black Death or bubonic plague spread?
17,697 in their account.
Sorry, just going to mute everybody very, very quickly. Sorry, folks. That's it. Okay. So, how was the Black Death or bubonic plague spread? Well, plague as an infectious disease typically takes two main forms. The one being the bubonic plague, which is what the Black Death was and the Great Plague of London. And the bubonic plague has a case fatality rate of between 30 to 60%. There's also another form of plague called pneumonic plague, which has a 100% fatality rate if left untreated. Now, the most common version, bubonic plague, it causes large swellings on the body, also called buboes, that appear, and that's that swelling of the lymph nodes and so on. Now, the plague itself is actually caused by a bacteria called Yersinia pestis, and it's usually found in small animals and their fleas. And plague is subsequently transmitted between animals and humans after being bitten by an infected rodent flea or through handling an infected animal. So, whenever the Black Death and later the Great Plague of London reached England at that time, it was the rats that did spread it, the black rats specifically. They spread it because they're able to easily move around human settlements, and they move towards human settlements for food and for shelter and warmth and so on. But in terms of what caused it specifically, it was the Yersinia pestis bacteria, which was present in the infected fleas that survived on the fur of the rats and so on. And then when a rat that was carrying the fleas on its fur dies, the fleas would feed on the rat's blood and then move to the next best thing, which was the nearest human being. And then subsequently it spread, within the population. Human to human transmission was actually very, very rare. Not impossible, but very, very rare. It was always that close contact with infected animals like rats and so on. Also, plague can be spread through sick pets, especially cats, and through direct contact with infected tissues and if you inhale infected respiratory droplets, again through that close contact with infected animals. And Daniel Defoe, he went on to further write, and this is really just to give you context about how people behaved at the time towards the plague. So they were very scared, and there were conditions put in place by the government, such as quarantine and isolation, and people were forced to stay indoors if they had displayed symptoms of the plague. But some people tried to break those lockdown rules, and again, I think there are so many parallels between the plague epidemics and also modern day epidemics and pandemics. So he wrote, many such escapes were made out of infected houses, as particularly when the watchmen were appointed by the government to make sure that people who were sick from the plague did not leave. When the watchmen were sent on some errand, to evade this and cheat the watchmen, people got 2 or 3 keys made to their locks, or they found ways to unscrew the locks and so take off the lock. And while they sent away the watchman to the market, to the bakehouse, or another, they opened the door and go out as often as they pleased. But this being found out, the officers afterwards had orders to padlock up the doors on the outside and place bolts on them as they thought fit. So, in terms of trying to control the spread, very, very extreme measures, locking people inside. That was not something that was adopted during COVID-19, thankfully. But during this time as well, like I said, the other different ways the government tried to get people to abide by the law and stop it spreading. They issued different plague orders and stuff. They issued isolation requirements for people who were sick. And there was actually legislation introduced in the early 1600s, which also provided financial help to sick families and introduced harsh punishments for anyone breaking the policy of isolation because of the plague. So there were things done by the government at this time, but it was very much not that effective because they didn't have that understanding of um, disease epidemiology and also infectious microorganisms. Now, there are still recorded instances of the plague today, and between 2010 and 2021, there were more than 5,500 cases reported worldwide and just over 1,100 deaths. Now, currently, the three most endemic countries in the world where plague still persists are the Democratic Republic of the Congo, Madagascar, and Peru. And certainly in 2017 and in 2021, Madagascar suffered large outbreaks of plague, where a person from a rural part of the country had, in essence, brought the disease to one of the main cities via public transport. And in 2017, for instance, there were more than 2,400 suspected cases of pneumonic plague in Madagascar, and there were 1,900 confirmed cases. And one study estimated that around 25% of people died as a result of that outbreak. And in that excerpt on the right on the screen, that's taken from the World Health Organization talking about the scenario in 2021, where as of the 15th of September 2021, a total of 20 suspected and 22 confirmed cases of plague were notified. And there's a breakdown there of which population groups were most impacted, and that's one of the things that we do in looking at how diseases spread, looking for those trends and patterns. So it is not a disease of the Middle Ages. It still exists, and there are still outbreaks even today with all of our advancements in public health. And whenever we consider, in summary, everything that's happened during the Middle Ages and all of these different disease epidemics, the reasons for poor public health are multiple, and some of them are listed here. Fundamentally, there was a lack of knowledge on the cause of disease. There was simply no knowledge of germs. Medical treatments were not scientific or evidence-based, and quite often, if a sick patient was cured from a particular disease or illness, then the method that was used to do that was considered effective, but it was more likely that it was down to pure luck. Equally, medical operations were carried out without any infection control procedures, such as, sanitizing of the environment, hand hygiene, instrument sanitation, and there was certainly no anesthesia available. Other reasons there, poor personal hygiene, lack of proper sanitation, like was mentioned, dangerous medical practice, imbalance in the humours, that was one of the reasons that they believed, and all of those other things that we talked about, and also poor quality housing, and it was also not a government priority. Now, as we move towards the 19th century and thinking about disease and trying to tackle all of these reasons for poor public health and thinking about the development of the current environmental health profession, when the Industrial Revolution developed, very much one of the things that became apparent was that the health and welfare of workers deteriorated. And in England, between 1801 and 1841, the population of London doubled at that time, and also the population of Leeds tripled. So there became such a demand for suddenly housing and also safe practices at work. And whenever we look at life expectancy rates for this time, they were very, very low. There were instances of child labour, people working in dangerous work in mines and stuff like that, and engineering and so on. And some of the other, infectious disease epidemics were still rife, thinking about cholera and other examples. Now, some of you may recognize both of these pictures. The picture on the left is showing the Aldgate Street pump in the city of London. Now you can see in that picture there's a young boy sitting with a flat cap just beside the pump, and there's people walking by. They all seem unaware that they are in the presence of what became known as the notorious pump of death. In 1860, people who were drinking from the pump noted that the water tasted bright, sparkling, and cool and had an agreeable taste. But what they didn't realize is that that agreeable taste was because of the calcium from the bones of dead fellow Londoners had leached into the water source from which the pump drew its water. And the water source was an underground stream that actually passed down its way from Hampstead Heath and passed on or through many graveyards at the time. Subsequently, the pump of death, it led to several hundred people dying. It became known as the Aldgate pump epidemic because people were drinking this polluted water, which was full of, in essence, stuff from dead and decomposing bodies. Widdard's tea merchants, based in Chelsea and London, famously also used to use the Aldgate Street pump, and in their words, always get the kettles filled at the Aldgate pump, so that only the purest water was used for tea tasting. So not very nice and not very good at the time. But epidemics like this were quite common in cities in the UK, and in London, there were a few, and I'll talk about one other in the next few minutes. But the Aldgate Street pump, it is still there in the city of London. Now, obviously, it's not a functioning pump anymore, but it's you can go and there's like a memorial plaque and stuff still at the junction of Fenchurch Street and Leadenhall Street in the city. The picture on the right is really just to highlight also the poor conditions people were living at the time and thinking about issues around overcrowding, children living in poverty, and so on. So all of these things in combination facilitated disease spreading within different populations. Now, the high levels of early mortality and morbidity led to certain key people taking a lead in public health and sanitary reform because they wanted to protect the poorest and the most vulnerable within society. And in 1834, the Poor Law Commission was funded and set up by government, and it explored the problems of community health and suggested a means for solving them. And really, it argued that the safeguarding of public health is the province of the engineer rather than that of the physician. And this was quite a groundbreaking statement at the time, because up until this point, community or public health was very much just the remit of medical doctors and nurses, delivering it from healthcare settings. But then they recognized that a lot of the issues that affect people's health and well-being are outside of the borders of the hospital or the healthcare setting. So we needed trained people, engineers, to really solve these problems in the built environment, to design in health into our cities and into our towns to protect people from infectious disease and other public health issues. Does anybody know when the first Public Health Act was introduced? You can write your answer in the chat. Just see if anybody has an answer. Some people are saying 1897, 1848, 1848, not sure, 1936, 1848. Okay, so there's a range of different answers coming in. I'll just move back to the presentation. So for those of you that said 1848, you were correct. The Public Health Act of 1848 It established a general board of health, really there to furnish guidance and to aid in sanitary matters for local authorities, local councils, whose earlier efforts had been impeded by that lack of a central authority. So the Public Health Act 1848 gave powers to local authorities to really deal with public health issues that were occurring in their particular district. So they were able to establish local boards of health to investigate sanitary conditions in particular districts. Um, and subsequent acts that were introduced in 1872 and 1875 and so on built upon that. So um, local authorities were able to regulate sewage and waste disposal. They were able to deal with issues around the housing of animals, around clean water supplies, the prevention and control of infectious disease, also, even things like the registration and inspection of private nursing homes and hospitals, the notification of births, and many other different things. The 1872 Public Health Act, it made the appointment of medical officers compulsory in urban areas to deal with public health issues as well. And the 1875 Act gave powers or required local authorities to provide water, drainage, and sewage services as well as part of that wider delivery of public health. Now, a couple of the key figures from this time in public health, and I'm sure most of you have heard of this man, Sir Edwin Chadwick, public health activist and reformer of poor laws in England. So, after the influenza and typhoid epidemics in 1837 and 1838 in England, in the 1840s, public attitudes towards health and also the government's attitude towards health began to change. Now, Edwin Chadwick, he was actually employed by the Poor Law Commission that I talked about that was introduced in 1834. And he was asked by Parliament to investigate the living conditions in Britain. Because at this time, the average age of a labourer living in Liverpool, for example, was just 15 years old, whereas somebody from the gentry or aristocracy could live on average to at least 50 years old. So there was a massive gap in terms of life expectancy, depending on where you were born, where you were working, and what type of occupation you were in. And so obviously this was an issue, particularly at this time when the industrial revolution was so key to the economic growth and success of Britain at the time. So in 1842, Edwin Chadwick published a landmark report called The Sanitary Conditions of the Labouring Population of Great Britain. And he concluded that the three main things needed to improve health within the population was effective waste removal, also an effective sewage system and clean running water in every house, as well as a qualified medical officer appointed in each area, which was then introduced in the 1875 Public Health Act. Now, his report was not always met with great acceptance by every member of parliament, but over time the changes were adopted. And in this graph is just to really show or highlight that difference between life expectancy rates depending on the area that people were living in. So the red bars on the graph represent an urban area, being Manchester, and the green bars represent people living in the countryside in a rural area. And you can see the average age of the people that died in those graphs. So certainly if you were a labourer living in an urban area like Manchester, the average age is just over 15 years old. But if you were a labourer living in the countryside or a rural area, you could expect to live on average till nearly 40 years old. And the other differences between those different groups are also highlighted there. And so this is what Chadwick wanted to address through public health reform. And certainly his report and his work and in promoting public health and driving the profession forward, he helped advocate and secure the first legislation. So there was the Nuisance Act of 1846, and that was related to dealing with sewage and offal and other sanitation issues. And then there was the first Public Health Act of 1848, which he also contributed to and was a strong advocate for. And he also became the first president of the Association of Sanitary Inspectors in 1884, who are a precursor to the current day professional body in environmental health, the Chartered Institute of Environmental Health. Now, the other key figure in public health that I want to talk about for a few minutes is John Snow, otherwise known as the father of modern epidemiology. And he's very important because it was his work in 1854, his investigation into a cholera outbreak in the Soho area of London, in which he was able to establish that cholera was caused by a polluted water. It was a waterborne disease. Up until that point, people still very much believed in the miasma theory, which I mentioned earlier on. And so he published his ideas in different essays called On the Mode of Communication of Cholera. And he looked at all of the deaths and plotted them on a map. And then when he removed the pump handle from the Broad Street pump in the Soho area, immediately the number of people dying stopped. And that was because clearly the water was infected with cholera. So people were becoming infected through this polluted water, which up until that time just simply wasn't known. And there is a replica Broad Street pump as pictured there that you can visit if you're in the Soho area of London. And there's also a pub right beside it. So who have adopted John Snow's name. And it's quite a nice pub. I've been in it a few times, and it's worth a visit. So John Snow, father of modern epidemiology, and linked the spread of cholera to unsanitary water. So because of the work of Edwin Chadwick and John Snow around sanitary reform, and with the introduction of the different public health acts of the mid to late 1800s, we knew that we needed a well-trained body of sanitary inspectors. And these sanitary inspectors, or inspectors of nuisance, were seen as practical doers who intervened in poor housing, amongst other things, and worked closely with the higher status and far higher paid medical officers of health. And sanitary inspectors, their job was really dedicated to not just poor quality housing, but also investigating industrial smells, accumulations of filth, offensive trades, any issues with sewage and drainage, issues even around public graves, abattoirs, and a variety of other environmental health related issues. So the environmental health practitioner, as we know today, evolved from those initial group of sanitary inspectors or inspectors of nuisance. And some of the important professional associations that were set up really to bring all of these like-minded professionals together to address the public and environmental health issues that were occurring at the time. Some of them are listed on screen. So in 1856, there was the Metropolitan Association of Medical Officers of Health. Then there was the Sanitary Institute in 1876, and they set about really improving the qualifications and standing of people who were charged with creating a healthier urban environment on a daily basis. We also then had the Association of Public Sanitary Inspectors, of which Chadwick was the first president, and that is the precursor to the modern day environmental health professional body, and also the Association of Medical Men possessing a qualification in sanitary science. Also, a bit of trivia too. Thomas Fresh, who worked in the Liverpool Borough in the mid to late 1860s, he became the first appointed inspector of nuisance, sanitary inspector, by the Public Health Act of 1848, really setting the path for a professional trail of sanitary inspectors, public health inspectors, and what we now know as environmental health practitioners to really intervene in all of those different public health and environmental issues that were affecting the nation. So he was the first one to kind of pioneer what we now know as the environmental health practitioner. And there is a little blue plaque to him that is up in Liverpool, which you can see if you visit. And towards the end of the 19th century and into the early 20th century, environmental and public health really focused on the whole idea of prevention rather than the treatment of disease and illness, which was within the remit of medical doctors and nurses and so on, people who work in healthcare settings. Environmental health, because we work with the public, we try to protect the public's health and well-being from infectious disease and poor quality housing, environmental protection issues, health and safety, and a range of other things. Um, we're all about prevention rather than treatment, so stopping people becoming ill in the first place and trying to act and work proactively. And the successes of all of those key public health figures of the 19th century and the advancements made in the early 20th century led to the creation of the modern day environmental health profession and its professional body, now known as the Chartered Institute of Environmental Health, which I'm sure many of you are aware of. And their current head office is in Chadwick Court, which is named after Edmund Chadwick in Southwark in London, and I'm sure some of you have visited. And today there are around 9,000 members of the Chartered Institute worldwide, with the majority being based in England, Wales, and Northern Ireland. And they work tirelessly helping to set and raise standards related to environmental health issues. They campaign on a number of public and environmental health issues, as well as support members' professional development and influence policy and work with government to influence key environmental health related policy as well across all of the core disciplines of environmental health. And in terms of how environmental health is delivered practically across the UK today, it's managed within every local authority across the UK. And in total, there are 343 councils in England. In Northern Ireland, we have 11 local councils. In Wales, there are 22 unitary authorities, which are made up of county and county borough councils. And in Scotland, there are 32 unitary authorities within which environmental health falls. So today, environmental health practitioners work in the public and the private sector. In the public sector, it's at local authority level, across all of the core areas of environmental health, either as generalists or specific to one of the disciplines acting within their expertise. And in terms of public health, the aim of environmental health and the workforce and the profession today is to really deliver those three key areas of or domains of what is known as new public health, which are health improvement, health protection, and improving services. And so under health improvement, it's things like addressing health inequalities, it's addressing issues around housing, lifestyle, quality of life and well-being, also helping in the surveillance and monitoring of specific diseases. Health protections, all about acting proactively to give people education and advice. You know, we deal with issues around alcohol, drugs, gambling, addiction, infectious disease, a range of different public health issues, and also in improving services through audit and evaluation, through good governance, and through good service planning, and so on. And you know, for those of you that have joined today and maybe don't know anything about environmental health, have never worked in environmental health, there are a number of different pathways. It's a fantastic profession to get into. You can learn so much and you work with so many different people and different organizations to really ensure that the environments that people work, eat, live and play in are ultimately safe. And we do that by helping minimize those different risks. And we on the profession also work with academic institutions, the armed services, different charities, and also global corporates to help regulate and enforce the law. So a last couple of questions to finish off, everyone, and I appreciate you taking the time to listen. And the first question being, do you consider environmental health to be an essential public service? So again, you can use the QR code on screen or the link that will be in the chat, because it's important, I think, that we have an understanding of the value that environmental health, the contribution that it makes to society, the positive contribution that it makes to protecting public health and well-being. So do you consider environmental health to be an essential public service. So you can access the link in the chat. I will reshare and we can have a look at some of the answers. Okay. 100% response rate so far for yes. It's good. It's good to see. Okay, excellent. And my next and last question, and again, it's very, very short, but again, it's good to gather you being members of the public, all from different parts of the UK, to gauge your attitudes and perceptions on important issues like this. In a few words, what is the unique contribution of environmental health to your life and society as a whole? Now that you have hopefully learned something about past epidemics and about the role and contribution that environmental health makes to protecting public health nowadays. And it can just be one word, it can be a few words, but it's just to gather up a kind of a nice picture of what you feel is the unique contribution of environmental health to your life and society as a whole compared to other professions. Because I feel it's important that we highlight the good work that environmental health does every single day. And again, a link to that will be posted in the chat. Okay, let's have a look at some of the answers very quickly. And apologies, I know we've run slightly over time, but it's nice to see that everybody has been participating. 10 responses so far. Being proactive and working towards preventing any health hazard from happening. Protection of public health at grassroots level. Very true. Some of it strategic, but much of it operational with direct involvement in the parties concerned. Finding resolutions to problems. I like that one. Excellent. And then some of the word cloud, and again, health being at the center, public as well, holistic. It's nice to see that you're picking up on those things. Problem solvers, involvement with parties, health hazard solvers who are capable, understanding of links. Environmental health do all of that and more. And it's really, really great to see that you all see the value in the profession. So I will go back and last couple of slides then just to finish up things. Now, one last thing I thought was worth mentioning, because maybe some of you who have joined this for the first time are not aware, but the Chartered Institute of Environmental Health, so our current professional body, as part of the current campaign, is that they want to help create an environmental health all-party parliamentary group, an APPG. Now, this is important because it means that we can bring environmental and public health issues directly to the forefront of government policy and engage members of parliament or the Lords on these specific issues. Because up until this point, we've never had an all-party parliamentary group specifically looking at environmental health and environmental health issues. Now, we need a total of 20 MPs to commit to this setting up of an APPG for environmental health. At the moment, we have 12. So what you can do to help is to download the letter template, which is available at that web link, and it's also available on the CIEH website. So if you Google CIEH APPG, you'll be brought to the web page which communicates all of this. And when you download the letter template, you can send it by post or email to your local MP, and then notify the CIEH policy team by emailing policy@cieh.org. And together we can reach our goal of 20 MPs and create a platform for lasting environmental health improvements in Parliament. So that letter template and then email the policy team at CIEH. There's some further information there, and the recording, I have recorded this, so it will be made available on public channels. You can come back and rewatch it afterwards, and just gives you some history about the profession and also different, you know, epidemic outbreaks and so on. Thanks for listening, everyone. I really appreciate you taking the time today. And this event is part of the ESRC Festival of Social Science 2024 and made possible thanks to funding from ESRC, which is a part of the UK Research and Innovation organisation. And there will also be a feedback form going out after this event. I'd really appreciate if you could spend some time and complete that as well. It should only take a few minutes. But are there any questions on any of this so far? You can, ask out using your microphone, or you can post questions in the chat if you want. Thanks, everyone. Thanks for your kind words. And hopefully, for those of you that have never had any experience of environmental health, you can talk to your family and friends and to, sons and daughters and stuff. It's a really, really good career path. Okay, I'm going to stop the recording there then.